So I want to briefly describe or summarize for you what I do as a geriatrician. Firstly, I particularly like taking care of people who are absolutely healthy like me. And I actually like them to come as a couple. I think that if you're going to succeed in your overall health and you're married, both the husband and the spouse or both spouses should come to the evaluation together and be seen together if you want to. You could be seen separately clinically, and you can also be seen together. And part of our role is firstly to comprehensively evaluate all your medical problems, make sure you're on the appropriate medications, and then spend a great deal of time on prevention, what you need to do to prevent yourself from becoming ill as you grow older, and also what to do and how to be educated if you do develop a medical illness. Also very important is to educate you and your whole family about what it takes to stay healthy. And fourthly, I think it's important that we see you at least once a year, maybe more frequently, if you do have other medical problems. So that's the one goal. The other goal is to treat patients who are functionally dependent. And half of those patients have physical disabilities, which we've talked about in the initial part of the show. The other part have memory loss, and we're going to get to that in a minute. But I want to first also talk about men's issues. You know, men do not pay as much attention to their health as women. And actually, if you look at who makes the medical decisions in a family, it's almost always the wife. And if a man is married, he is far more likely to wear a seatbelt, to see a doctor more frequently, to take his medicines, to be appropriately screened for disease. And the chances are, if he's over 70, he will live 10 years longer than a single man. So every night, go home and thank your spouse for keeping you alive. But men's health is important, and it's particularly important to Baxter Regional. And on May the 14th, is that the correct day?
Yes.
We are going to have Men's Health Day. And I'm going to be at that meeting talking about if you want to live long, be a better man. But Nancy, tell us a little bit about men's health and why men my age, younger and even older, should come to this wonderful day.
Well, this is a really great program. It's sponsored by the Muruck Family Education Center on Aging, and this is actually their 7th health forum for the men. And what I like about this is an atmosphere that allows men to ask those health questions that may be concerning them, and they may forget when they're at their doctor or they're a little embarrassed, but we really try to tackle those tough subjects for men. And we've got some great speakers this year. As always, we try to get the area doctors involved, and we're very thankful that they come out and help to educate them about their health. This year we have Dr. Ronald Bruton, who's going to be talking about integrative health, and they've actually just opened a new facility, and he's going to talk about some alternatives.
So what do you mean by integrative health and alternatives?
Well, what they do things from a little different perspective. They offer services like acupuncture, massage, Tai Chi, and I'm not sure of everything they offer, but
I suspect that if most groups might also offer alternative medicines as well, herbs and potions and other things that theoretically, the evidence that they might or might not help is often questionable, but there is a place for alternative therapies in promoting and maintaining health. Acupuncture is critically important. Chiropractic care, you know, is as good for back pain as anything else. So we've got integrative medicine. Yes. What's next?
Dr. Moore is going to talk about hip, knee, and shoulder replacements, which is most of us will experience at some point if we live long enough.
You know, there's nobody who doesn't have a problem with their hip or their knee. And I can tell you this much, if you've reached that point in your life where pain in a joint is interfering with your ability to function or get around, and you can't stand it anymore. The benefit of these procedures done in the appropriate hands can be pretty good, and a lot of men suffer from joint problems. So we've got integrative health and joints. What's next?
Then I think after lunch, this has become very popular. We have several doctors who are going to be on a panel to answer questions about just men's health concerns. The men are given a little card at the beginning to write down questions.
So they don't have to answer it.
They don't have to stand up. Yeah, they can do it in private. So this year on our panel is Dr. Ronald Tilley, who works with pain management, Dr. Dan Sawyer, who's a surgeon, Jason McConnell, who does orthopedic surgery, and Dr. Scott Ezel, who's a family medical practitioner.
So
a nice variety.
You know, there are I know this is sort of a little touchy subject, but one of the things that I find, obviously men are rather embarrassed about erectile dysfunction, you know. I mean, that is always a question. And it always seems to be something that they only want to bring out with a high level of reluctance. So I might spend a half an hour with a man going over his high blood pressure, his heart disease, his lung problems, etc., and then also promoted health and told him what he needs to stay healthy. And as he's about to open the door and leave, he says, "Oh, by the way, doctor,
yes,
do you think Viagra can help me?" And that usually is a sign that there is a problem. And sadly, the management of erectile dysfunction, as any good doctor will tell you, or advanced practice nurse, involves much more than a pill. And having an ability to discuss it in an open way that is productive and important can help a great deal. I always tell my patients when I talk to them about issues that are sensitive, that this clinic room is like having an audience with the Pope or a confession to the Pope. Whatever is said in that room is absolutely confidential. And I would urge anybody who's got problems that they find embarrassing to make sure that they talk to their doctor about it and talk to their doctor first, and not at the end of the visit, because I can tell you, if you've spent a half an hour with someone, hey, it's out, come back next time.
Yeah. And you bring forth, and that's an important topic with the men, and usually that's covered every year at the Men's Health Forum, and I wouldn't be surprised that that comes up in our panel discussion this year.
And by the way, there are no women there.
No, they'll have some booths out front and some screenings. They're going to have hearing testing by Taylor Hearing, and we do balance testing and usually blood pressure screenings. But when the men go into the room with the doctor, they actually close the big door so that it's only men in the room.
So there are no women listening outside with big...
No, you really, it's pretty soundproof in there.
What my wife would say to me, what did they say in there? So what else about this? Anything else?
Well, and then you're going to speak again. You'll be the keynote speaker at the end.
And what I'm going to talk about is really that if you are a better man, the chances are you will live longer and be healthier. We know, for example, that people who are happy, people who have faith, people who have it in their heart to forgive others, people who are seeking redemption for things that have happened in the past will live longer and age better. So I would urge that everybody, and I mean everybody who is not a woman or who doesn't think of themselves as a woman, feel free to come to this men's health clinic. I will be there. There'll be booths, and there'll be a great opportunity for you to engage in all of the experts who come from Baxter Regional and tell them what your concerns are and assure that your health and your illnesses are appropriately managed.
And I would just like to recommend that they call the Muruck Family Center on Aging and register, because they do give free lunch that day. And so they'll need a count And if it's okay, I'm going to give the number. It's
ahead.
870-508-3880 to register for that. And it's a great program. We've always had a good response. We're so thankful for all the doctors to come out and share this time with the men in our area. And I always say that, people always ask the age on it. And I say, I think 35 up, men, we need to educate younger.
Let me tell you, teenagers need this. So if you're a man, come along. We'll find something of interest to you. Nancy, it's been a pleasure.
Thank you, Dr. David.
Thank you for talking with us. And I want to tell you how much I appreciate coming up here to Mountain Home. I love the drive. I love the people. And I'm so grateful to Baxter Regional for giving me an opportunity to be up here and maybe make a tiny little difference in your lives. I'm going to be back next month, so have a great early summer.